tell me about your life before you met me.
Okay, well, my injury happened, 6 years ago, basically?
Yeah.
And before that, I was training to fit into a Spider-Man suit.
Oh, okay.
And I was like, on the outside, I was in the best shape of my life.
Yeah.
And
So you were an active person, in good shape. Okay.
Very.
And then you had an accident. When was that?
It was March 13th.
About 5 years ago.
About
5 years ago.
And I was on a trampoline, and I was on there with my daughter, and I was just gonna land on my butt, land on my feet. I mean, nothing that I shouldn't have been an issue at all.
Yeah.
And when I landed on my butt, I heard and felt a crunch.
Where did you feel the crunch?
Right in the middle of my back.
In the middle of the chest area?
Yep, yeah.
Okay. So, and then went down the hill from there, right?
Yeah,
So
everything just fell apart after that. I tried to...
Tell me about your symptoms. What did you feel?
It was intense pain. It was the worst pain
tell me
I've ever
about it.
felt.
Okay.
Sharp.
Okay. In the mid-chest area?
Yeah.
Did it turn around the chest?
It took the wind out of me,
Yeah, so it did turn around the chest? Tell me about it.
It was both sides. It just felt like somebody had cut me right across my midline and my back.
So the sharp pain turned around the chest. You said it came to your sternum.
Yeah.
Is that right?
Yeah.
For 5 years.
Yeah, and at its worst, I couldn't get up from a laying position.
Yeah.
I had my...
How did you live with it?
I don't even know how I kept pushing, but I kept pushing.
So what did we do for you?
I did injections, physical therapy, acupuncture, chiropractor, over-the-counter medication, prescription medication.
All of that wasn't helping you? Okay, well, unfortunately, I hate to say that, but you have been told, to just live with it. It's in your head. It's not real.
Yeah,
I've been told all of that. Tell me about it.
Yeah, I was told it was chronic pain, and after you have pain for so long, they say it becomes chronic, and it's just that there's no cure or solution. It's just going to be something I need to learn to live with.
When did we meet? We met a few years back.
Yeah.
And we didn't jump to surgery either at first.
No. We said we were going to watch it and wait.
And we watched it. We did additional conservative therapy, which didn't help you. But then, and in the MRI, we noticed that there is a divot in that disc. That part of the disc actually broke inside of the bone.
Yep.
And that was our concern. And then, but my plan was, giving you another set of kind of physical therapy, which we did, which didn't help. And then finally we did a test to find out if that is the problem or not.
Yeah, we did a discogram.
Yes. With the MRI, now I understand my colleagues that they say, that doesn't look that bad, but MRI is a static picture. It doesn't show you how truly these things are when you put them at the stress. And discogram is what put it at the stress. To see not how it looked like when you're laying on your back, putting no stress on the spine in the MRI machine, but by us putting a needle in and increasing the pressure, we can provoke it. We can literally produce the situations where you are doing things like living with that disc.
Yeah.
And we noticed that disc is not in a good shape.
Yeah, no.
It took you a while, but to come back and, but finally you came back and say you want the surgery, then that minimal invasive direct thoracic interbody fusion, that's a procedure that we invented actually. Because once we know that the spine in the chest is the problem, lack of what we do is the solution for that is cracking open your chest, taking a rib out, collapsing your lung. That's a tremendous surgery, putting you in the hospital for a whole week in the ICU for 5 days, chest tube and so on. And because the threshold is so high, most of my colleagues are trying really absolutely not go there. But we didn't do all of that. Tell me about your surgery. When was it?
It was December 12th.
Okay, so about a month ago.
Yep.
So how are you now?
I'm feeling great as far as my back goes. Yeah, I feel...
How is that sharp pain that was turning around the chest?
It's gone.
When did it go away?
It was about a week after surgery.
I remember your surgery. Your surgery was under 50 minutes actually, the method that we did. And if you want to look at that, we put 2 screws here in the upper bone. And look at that. That is the structure it goes in. It's perfectly positioned. Like, screw is barely bigger than the structure it has to go through, because we use two C-arm that enable us to do that. If you don't use two C-arm, it's really hard to do that. That's another reason why my colleagues scare away from putting screws here, because thoracic cord there, that would paralyze you. If that screw is not in the right position, you would be paralyzed. But with proper training, as you see, we do it all the time. This is for us nothing so far. Tell me, how are your daily activities so far?
So far, well, I still have been taking it easy, or trying to take it easy. I guess I've been corrected once or twice that I need to not do so much.
Yes, exactly. But I think we are on a good path. But what are the things that you could do now that you couldn't do before the surgery, or vice versa?
Well, as of this past week, I've been able to sit up without pain.
Okay.
Which is amazing.
Okay.
Getting dressed is great. Almost back to not having to modify my movements to get dressed.
Excellent. And what do you notice just observing him and in that daily activity and life?
He's not miserable constantly.
That is a change. Yeah. Well, it's so 5 years of misery, and then a 50-minute procedure could reverse that process. That I'm very happy. Thank you for the interview.
Yes,
okay? Thank you.
Problem.